Akamai Cannabis Consulting, comments?
Aloha, Chair, Vice Chair, members of the committee, Dr. Clifton Otto, offering comments. You have my written testimony. I just wanted to highlight that this is a very important bill for patients who need help with cultivation on islands with a dispensary, so much so that the governor issued Executive Order 2406 and asked the legislature to address this issue this session. There's also another way that we could help patients with cultivation, and that would be to expand the ratio of patients to primary caregiver from 1 to 5. This provision was adopted by HHS in the Senate and carried by JDC, and unfortunately removed by Health before coming to you. Agencies are making arguments that it would be dangerous to have a caregiver take care of 5 patients because this would mean 50 plants on one property. But the law already allows 5 patients to grow together at 10 plants per patient. Patients are already allowed to have 50 plants on one property. It's also argued that expanding the ratio would encourage commercialization, but patients are already allowed to assist each other with the costs of cultivation growing privately on one property. In addition, an argument is being made that if a primary caregiver was allowed to take care of 5 patients, they would be transporting 20 ounces of cannabis from a dispensary. And from my own experience with my patients rarely purchase more than 1 ounce at a time, and that often lasts them for a couple of months. So I think it would be very unlikely that a primary caregiver purchasing for 5 patients would be carrying more than what's probably allowed for 1 patient. And I'd also like to note that it could be very helpful for patients who cannot travel to do a dispensary to have a primary caregiver who could purchase for more than 1 patient. So this bill also includes enforcement measures that I think will discourage criminal activity and make it easier for the department to enforce the law. And so I'm asking that you please consider adding back the provision to allow a primary caregiver to care for and cultivate for 5 patients. Thank you for considering my testimony. I'll be available for any questions.
Thank you.